Health informational session. This particular session is regarding the topics of LGBTQ plus services. And we're excited to have this be a hybrid meeting today, both in person and virtual online. So if you are online, please be sure to mute your laptop so that we don't get double feedback. But feel free to put any questions that you have in the chat box. We will have a person monitoring the chat and asking questions. For the audience members, please also be sure to mute your cell phones and your laptops during the presentation. This will be recorded and we will be posting it online on our website for future reference. So with that, we'll go ahead and turn it over to Alicia.
All right, folks, lovely to see so many folks here today. I'm Alicia Muskies. My pronouns are she, her, hers. I'm a PM3 in behavioral health in our access division. So we're super excited to tell you about all the programs that support LGBTQ plus folks in our behavioral health access division. I want to start off by saying before we jump into that there are a lot of other programs that have paved the way for programs like the Q Corner and the Gender Affirming Care Clinic and our Harm Reduction Project. So we want to give a big shout out to programs like LGBTQ Wellness and LGBTQ Youth Space and Bill Wilson Center's Connection Program and a bunch of other, and the Gender Health Center and Office of LGBTQ Affairs. We are not the only group out there supporting community, but we are really the kind of main group of folks in behavioral health that have county behavioral health run services. So that's what we're talking about today, but it does not in any way diminish all the other community run services that are out there. So we have an amazing team. Here's a picture of our Q Corner folks. You're going to hear from a few of them today. And just to kind of give you a little bit of a timeline where where we started, where we're going. So back in, well, actually, I'm going to take us back even before this timeline. So in like 2012, our public health department did an assessment on the status of LGBTQ health. And it was the first local assessment to really identify what are some of the gaps in services, the gaps in care, et cetera. And folks overwhelmingly said there were a lot of barriers to folks accessing services because providers were not knowledgeable, services were not affirming. There were really traumatic and damaging and harmful experiences that folks would have in service delivery system experiences. And so because of that, there was really a need to create both peer-run services that would help folks get connected to services, help folks get support and connected to community, as well as a huge component of trainings that would be about building knowledge and competency around providing affirming care. So with all that being said, back in 2018, the MHSA stakeholders, they pulled together recommendations for LGBTQ access and linkage / cultural wellness program, which is now called the Q Corner. So we started planning back in 2018 with our colleagues from a lot of the aforementioned services. And then we were planning to launch in 2020. And I think everyone knows what happened in March of 2020. So we sort of had a soft launch. We started providing a lot of services online. And then you fast forward, over the next couple of years, we kept growing. We were able to open our small little Q Corner at 1075 East Santa Clara. That you're going to hear a little bit more about what services are offered there. And then fast forward to now, we have this beautiful team that you see on the screen. There's about 10 folks from Q Corner. We're creating our Gender Affirming Care Clinic. We have our Harm Reduction Project. So a lot has grown in the last couple of years, and we're excited to tell you about it. And I will say that there's more to come. We are building out space for all of these services to be all together in one place on Center Road. It's called Collective. You're going to hear a little bit more about that later. So yeah, that's a lot to share. So with that being said, this is a placeholder for our flyer. We have it in English and Spanish. And Pia, who is one of our peer support workers, is going to tell you about the services that the Q Corner provides.
Hello, everyone. Thank you so much. My name is Pia Cruz. My pronouns are she, her, hers. I'm a mental health peer support worker with the Q Corner. So lovely to spend time with all of you today. Let me see, how do I? Perfect, awesome. So here we have basic info and eligibility for our program. We're open for all ages. How can I make this bigger? Can I open like this? I think I did it right. Our mission is to support the LGBTQ community in Santa Clara County through direct service access and linkage to community resources and building an affirming service delivery system. We serve the LGBTQIA plus community members, all ages, like I mentioned, also as well as their families, friends, and allies. So we have services, support groups and such available for families as well. Cost, it is free. All of our services are free of charge. And we offer peer support. So that's on an individual and group level. We're a peer-run, peer-led program. We offer resources and referrals to mental health care, gender affirming care, let's see, and resources outside of the county as well. So to all of our community partners. Why is this so small? Okay. Community building activities and capacity building. And we have drop-in hours. So we offer our services throughout all of our time there during the week, but we have drop-in hours where folks can stop by our space to access physical resources, which are 12 to 2 or 9 to 11 on Tuesdays, 3 to 5 on Wednesdays, and 12 to 2 on Thursdays. So it's a wide variety of hours, so folks can fit that into their schedule. Probably one of those days will work for folks' schedules. Awesome. Ooh. We offer gender affirming garments. So for trans, non-binary, and gender expansive folks, a huge part of helping us feel affirmed and comfortable in our bodies is gender affirming garments. That includes binders for chest compression, gaps for tucking, trans tape for either, binding or tucking. We offer those for free. We have vendors with companies who help us disperse those for free. So folks can come in, just register through our link, and we will get those either mailed out to you discreetly, or you can come in and pick them up from us. So we think that's a valuable service that we offer, especially if we don't see that offered anywhere else. We think that's really important. Awesome. Okay, community building. I think probably the strongest way we see public interface is probably through our social media. Our social media is popping at the Q Corner. So please follow us. Like all of our posts, we're trying to hit 5,000 subscribers. We offer Q Corner chats. So these are little info sessions on various aspects of things that might be relevant to community. So we just had one. We've teamed up with a couple different groups over the years. So we've done ones with Oasis Legal Services, stationed out of Berkeley. What was the last one we just did? Name and gender marker change. Thank you. Yeah. And we have community building events. So we offer a gay hiking group that meets once a month. We offer holidays, gifting, and parties. So that is sort of our gift drive that we help underserved populations get gifts during the holidays. It's really important. We've done online trivia, other events as well. So just like little things that help community social building. Peer support groups. So this is, again, like I mentioned, we're a peer-run peer support program. So our peer support groups are an essential part of what we do. We offer a couple different ones that are advertised here. We have a queer and Asian group. We have a trans group that's offered both in English and in Spanish. A Latinx Diversa group for Spanish-speaking folks across community. And we have a families group, as well as a queer and disabled group. So a lot of different groups meet a wide variety of access needs for folks seeking those types of services. And tools to build on. Yeah, so another thing we offer is resource orders. That's going to be on the next slide as well with a little link. But here's just a couple of the things we offer is visual cues. So placards, stickers, anything you can put up in a building that can help folks see and know that that's a safe space for them. As well as things like pronoun stickers for your badge, little badge attachments like is pictured here, like with the rainbow colors. Resource guides from the Office of LGBTQ Affairs. Let me see, what else? Activity books, cards and books, swag items, notebooks, stress balls, all sorts of little fun little tinkery type things. And yeah, best practice guides for transgender health, proper pronoun usage, transgender law center, etc. And here is our resource order form. So we have a tiny URL with the Q Corner as well as the QR code down below. You just scan that, fill out the resource order form. And again, similar to the other binders and gaps orders, we'll fill those resources and be able to deliver them to you, or you can come pick them up at our office. So yeah, Awesome. With that, I'm going to pass it on to my coworker, Isa, who's going to talk a little about the trainings that we provide. Thank you.
Right, I don't know where to look. Hi, everyone. I'm Isa, they, she, I'm the management analyst for the Q Corner. So a lot of the work I do is related to the trainings that we offer. And I'll also talk about the Trans Care Coalition, which we're really excited and proud of. So the Trans Care Coalition kind of launched in 2021. And this included folks that work in behavioral health, whether within county or outside of county within the community orgs. So we had different work groups, or we have different work groups. One is the Creating Welcoming Environments work group, and I'll show some of the materials that came out of that in the next slide. There was the SOGI data collection group, referrals and placement, clinical services delivery, and care and institutions. So these were different work groups that discuss these different aspects of best supporting the trans community when it comes to behavioral health services. So really champions in the work kind of through different departments and in different agencies within county and outside of county. So the vision here was equitable access and knowledge and gender affirming care for folks at all levels of care. And basically just bringing together champions, continuing this work collectively rather than isolated, and pulling in that knowledge and expertise. So yeah, that includes identifying specific needs and challenges, and implementing the best practices throughout organizations. So we'll talk a bit about how we are doing that. So like I mentioned, these are some of the materials or booklets that came out of the Creating Welcoming Environments group. So you can see on the left-hand side, there's a Creating Welcoming Environments kind of trifold. So that's for agencies to kind of look at what steps can be done or taken to build more affirming and welcoming environments. So kind of a checklist is included in that. And we have soft copies and hard copies of these. So if folks want to request them, they can do that. They can come into our office and get them. We can send soft copies if you want to kind of have them and print them out. So creating welcoming environments, again, that's a trifold with, you know, steps to take for a more welcoming agency or environment. In the middle, you'll see our pronouns booklet, and that is kind of just like a booklet on like, why do we ask folks for pronouns? How do we ask folks for pronouns? A guide to kind of, you know, looking at different ways to use different pronouns, and just some kind of like common questions that we get or considerations within that. There's different websites for folks to go to where you can get some, you can kind of hear the pronunciation of different pronouns, specifically neopronouns, and kind of hear them in different sentences or contexts. So it's really helpful for folks who are learning to use a pronoun that maybe they've never used before. And then on the right-hand side, you'll see SOGI data collection best practices. And so as folks know, we collect demographic info in our agency. So part of that being race, ethnicity info, and more increasingly as standard practice is SOGI data collection. So sexual orientation, gender identity. But folks may be thinking about or questioning, like, how do I do that? How do I do that respectfully? How do I feel more comfortable doing this? So this guide really helps with that, and with like what data, like what response options or data fields to have, and how to go about that. All right, and then we have our trainings. So we have a ton of different trainings that we offer. You'll see our understanding gender attraction and expression beyond the binary. That's on the top left-hand side of our regularly occurring courses. We offer this monthly through SEC Learn. Folks can register on SEC Learn. We offer CEs for that as well. We have staff and team that provide that training. This is a 6-hour split over 2 days. And it's really just foundational SOGI 101. So sexual orientation, gender identity, and expression 101. So going over terms, concepts, and some practice and application. We offer gender wheel workshops focusing on gender and kind of looking at nature and animals and how there's kind of variety in like gender and expression in that way. And we have books as well that come along with that. So that's really helpful for folks. And this is great for folks working with young folks and families, because there is a focus on gender, pronouns, expression, and bodies, and less of a focus on attraction or relationship or quote unquote sexual orientation. We have queer intentional peer support, which is really great for folks who are within community providing peer support. We have gender affirmative consultation. So we have someone on who will speak in a bit. Ben, who's starting the Gender Affirming Care Clinic, and Michelle, who are really great and facilitate this. So if folks are looking for some support and consultation, this is a great group to join. We have the Family Acceptance Project, which is Dr. Caitlin Ryan, who did some of the initial and kind of like globally known research on supporting families in supporting LGBTQ youth. So that's a really great full day training. There's a guest speaker that comes kind of about midway through that folks really appreciate and love hearing from. There's great videos that are incorporated as part of that. And we have posters that we can provide. I won't spend too much time on a lot of these, but folks can look at the different options for trainings that we have. So these are the most regularly occurring on the left, and then on the right, you'll see every now and then we'll be able to offer some more content specific trainings. So one of those includes our clinical academy. So the applications are open here. So if you are a clinician, master's level clinician or higher, you can attend or kind of see your eligibility and go to that link. We can probably put in the chat in a bit. But those applications are open. It's really great. We really highly recommend folks to join, especially if you've done a 101 and you're looking on how to kind of build from there or move forward from there. And like Alicia said, we started or tried to start kind of virtually online 2020. So we've kind of built since then, but you can see kind of the impact, I guess, of training participants through each of these fiscal years. And so on the top, you'll see the training participants. And then on the bottom, you'll see that outreach for peer support, outreach events. And we have a really great team of peer support workers, community outreach specialists. You'll hear from our harm reduction team in just a bit. So I don't want to take up too much of Tessa's time. And with that, I'll go ahead and pass it to Tessa.
Hi folks, thank you, Isa. My name's Tessa. I'm, she, they are my pronouns. I'm a rehab counselor / harm reduction specialist that works with the Q Corner. I was just recently hired on to help launch this amazing harm reduction project that we are trying to bring low barrier access, substance use care access to the LGBTQ+ community. What this would encompass is trauma-informed care, drop-in groups. We're offering support on a one-on-one basis, a group basis. We also are doing a lot of trainings within the county in terms of like Narcan, access to Narcan, how to use it, as well as safe use techniques and skills for folks that are engaging in substance use and just are really looking for a safe space and, partnership with folks that understand and care about, just making the greater good in the whole harm reduction community and meeting people where they're at essentially. So what we have also is another component where we like to connect. We are really amazing connecting with our partners, and we love to help folks get referred to the right services for them. So once they identify their need, we can help them connect to maybe housing resources that are available within our county. We can help them connect to HIV, STI testing, mental health and physical health care, in addition to legal resources. That can also include name and gender marker, which we do trainings on. So we have a lot of possibilities within this project. So if you're looking for any kind of Narcan trainings or, just kind of 101 on harm reduction, feel free to reach out to us. This is our flyer. We have it in both English and Spanish. And then I'll move on to the next slide. I'm Tessa, as I said. I have a co-partner, Eric, who's not here with me, but he's a community outreach specialist and does a lot of the community outreach events. We do a lot of tabling events and just educational components within the community with at high schools, community colleges. So we're just kind of getting everywhere we can who's interested in getting access to Narcan or more information on safer use skills. And so here's a slide, just a little bit about harm reduction overview. So the principles of harm reduction are really like to collaborate, respect, acceptance, compassion and empowerment. So this is how we work in like a holistic capacity with folks and really client-centered approach. I'm sure a lot of you that have known about harm reduction, we hear meet people where they're at. I always like to say meet them where they're at, but don't leave them there, right? We're really trying to help people, you know, build motivation a lot through like motivational interviewing skills and really bringing them into a different stage of change with their substance use, if that's what they're looking for. If not, we just, you know, simply accept people for where they're at. And from, you know, my understanding of working in substance use for over a decade, it's a lot of trauma. So I really like to bring a lot of trauma-informed care and really just being with people. So that's where I really, if you can see the Maslow's hierarchy of need right there, like we tend to maybe want to get to self-actualization or how is your self-esteem before we've even met these basic needs of food, clothing, and housing, which I love what our county and community is doing with the Housing First model, which also works encompassing harm reduction approach, because if folks aren't able to access their basic needs, it's really hard to sit still and, you know, do therapy with a clinician when their tummy is grumbling and they're hungry. So that's where we really like to kind of work from the bottom up in a sense of like being there in that moment rather than, hey, you come here and be this person in our program. So just really low barrier threshold. I have a couple information on there about different places, National Harm Reduction Coalition and SAMHSA, of how they identify harm reduction. There isn't really like, here's how harm reduction works because it is so fluid. And we have also, you know, it encompasses social justice, it encompasses substance use, it encompasses drug laws, it encompasses all sorts of dynamics that are in a person's life. So I love working in harm reduction. And who knew? Who engages in harm reduction? It's pretty simple. Everybody does. All of us sitting in this room have engaged in harm reduction, and we probably engaged in it today on your way to work. Because if you look at here, we have sunscreen. It's kind of sunny out. I hope we did that. You know, using a helmet when you're riding a bike or you're doing some sort of extracurricular activity, speed limits, speed belts, these are all harm reduction approaches. When we look at like the 21st century, it's almost like we have adopted harm reduction as our school of life. However, when we look at harm reduction in the substance use model, there's still a lot of stigma and discrimination towards substance users. So that's where when we go lower on this list, when we start looking at things like medication assisted treatment is starting to come, you know, more on the forefront of helping folks with substance use disorders, and nicotine replacement therapies. Those are harm reduction, safe consumption site, and overdose prevention sites. That's where we can get really like, oh gosh, this may not be what we need in our country, but if we look at it realistically, we have them. They're bars. We go to them. You've all been to one. That is a safe consumption site that we have here in the United States of America, because we've, you know, condoned the use of alcohol in our country. So we say, hey, go to this bar, you'll be safe, we'll serve you what you need, the bartenders will help, you know. So it just kind of looking at parallels, I think, are really helpful when we're looking at harm reduction, because, you know, just historically the controversy that has been brought with harm reduction. And syringe access programs, shout out to Needle Exchange, formerly known as Needle Exchange, the Sharps program with public health. They've been running their harm reduction needle exchange program since 1990 in this county. So they're like one of the first. So they have also wonderful resources. We partner very well with them in terms of getting access to safe use supplies, more educational material, and just overlapping with clientele that we serve in our county. Overdose first aid, I talked a little bit about Narcan. So we as well see that there is an overdose fentanyl crisis that we are having in our country, and a lot of folks are trying to get access to Narcan. You can get that through us. We also have our partnership with Scoop, and then our partnership with the Sharps program, all have access to Narcan. If you've been walking in the community recently, you might have stopped by Main Jail, see they have a vending machine. So we're really starting to like bring a lot of this back, or excuse me, into the forefront. Just for a little tidbit, Narcan was invented in 1961. It was made prescribable in 1971. So I know a lot of folks think, oh, this just came out, like what a great tool. It hasn't just come out, it's just become a little bit more destigmatized to actually get it in the hands of folks that need it. And that has been a tireless effort that the harm reduction community has been doing for years in terms of trying to get access for folks to, you know, substance use first aid. And then I don't want to skip, you know, a really important part of what harm reduction work does. It supports sex workers and making sure that they have a space to be heard and seen. And as well, we can look at harm reduction, you know, safe sex, that's a harm reduction approach. So we have a lot of these things in our community. And I really urge you, if you have been like, harm reduction, you know, not really for me, not for the folks I work with, reevaluate that with a really compassionate and non-judgmental lens. Because if you're working in substance use treatment right now and we're not endorsing harm reduction, we're harming our clients. And we are really saying like, hey, you got to do this in order to engage with my program, rather than what can I do to help serve you to make your life a little bit easier in order to possibly get to that stage that they do want to seek some type of abstinence-based treatment. Because it is known that folks that engage in harm reduction services, they're 5 times more likely to go into a different stage of change and, you know, maybe a more abstinence-based. Because let's be real, being in a healthcare profession, we know that the illicit substance, and right now with our poison drug supply that we have, you know, in America, that it's very harmful and people are dying before they can even get to that door of, you know, detox or residential or whatever might be really their goal in mind, but just the struggles and the barriers and, you know, the inequity of services that we see along harm reduction is really what keeps people in silos and unable to access these programs. So thank you guys so much. I am going to pass it off to a wonderful colleague who will talk more about our gender affirming clinic that will be coming up soon.
Thanks, Tessa. Hi, everyone. My name's Ben. My pronouns are he, him, and I am the program manager for our brand new clinic within Behavioral Health Services Department, the Gender Affirming Care Clinic. So we are a sibling program with the Q Corner, and together we're called Collective, which Alicia named already. We're really excited to be co-located, so we'll be co-housed with the Q Corner, which means that both of our services will be available in the same location. I have been a mental health provider in the gender field for over 15 years in lots of different settings, in schools, in private practice. I was at the UCSF Child and Adolescent Gender Center, which is more of a medical focused program that supports pediatric gender care, getting access to medical intervention if folks want or need. And I focused a lot on training medical and mental health providers. I'm really happy to be here at the county. My first day was Halloween, so I've only been here for about 8 months. And in that time, we've done a lot of program development, which I'm excited to share with you today. So the Gender Affirming Care Clinic is a behavioral health clinic for trans and non-binary folks ages 5 and up. So it will span systems of care, both CYF, children, youth, and family, and adults and older adults. So we'll be seeing all ages 5 and up. And we'll be working with folks who have Medi-Cal insurance, as well as folks who are uninsured, and we are working on Medicare as well. So our staffing is myself, and then we have 2 mental health peer support workers, one of which has been hired, Blake Baza. He is starting in a week and a half, which is really exciting. We have 3 clinicians, and one of which has been hired, and they are right here today, Caitlin Ma. So we're so excited that they've joined us. They started on Monday, brand new. We have 1 clinical supervisor position, which is really excited. This is a new code within our department. And so we're really grateful to have gotten one as we are developing lots of the clinical structure and clinical processes to have more support for clinical staff as they offer direct care. We'll have 1 psychiatrist and 1 psych tech to support the psychiatrist, and then we'll have 2 HSRs or clerical staff that have access to our electronic health record system. So what we have been working on so far, a lot of space planning, like even finding a physical location has been quite a bit of work. We have found a physical location. We're going to be at 1870 Center Road, again, along with the Q Corner. So we've been working quite a bit around space planning. What do we want the space to look like? Furnishing the space, building out the space. We're working with Pivot, the design firm for furnishings. And then clinical systems have been quite a bit in development as well. I'm just noticing there's something that I added that's missing, but that's totally fine. So the clinical systems that have been in process, we're working on Medi-Cal site certification because we are going to be serving Medi-Cal beneficiaries, building out our avatar system and workflow and what that looks like for the clinic, and then creating the programmatic structure for clinical operating system. So what clinical services do we want to offer? What is that going to look like? How do clients find us? How do we do intakes? How do we work with the call center? All of those questions we are working on. And with this population, we want to keep in mind that not all gender diverse folks have disclosed their gender diverse identity or want to disclose their gender diverse identity when they try and access care with us. So we want to be really aware of multiple ways that folks could say, hey, I want to go to the gender affirming care clinic or I need these services. So we'll be thinking about that. So our services that we have built out so far, we'll be offering lots of different types of therapy, so direct service mental health support, individual, relational, and relational means not just couples therapy, but relational therapy for all relationship structures. So folks who are non-monogamous, polyamorous. We'll be offering group therapy and family therapy, again, around the we will have a primary client who will be the medical beneficiary, but with gender care, we really have to support the whole system that the client is in. So if that's a family system, we'll support the family, multiple partners, support the partners. There's youth involved, their kids, we'll support the youth. So really supporting the whole system that the client is in to support the client in accessing their holistic wellness. We'll offer peer support, and that's assistance with system navigation. So how to find resources, whether it be medical or housing or other, but how to navigate our large amount, right, of county resources, how to access them. We'll also offer advocacy. So if folks are trying to access resources and they're facing potential discrimination and stigma, which often is due to just lack of awareness, right? People don't really know about gender diversity or how to support trans and non-binary folks. So we will offer advocacy so that folks learn how to support trans and non-binary folks and support our clients. And then resource linkage, and the Q Corner has so many resources. So again, grateful to be co-located. So we'll just connect folks really quickly in that way. We'll also do a lot of psychoeducation. That's a really big part of gender care. So offering resources on what gender diversity is, offering a historical context on gender diversity, the fact that gender diversity has existed across time and across cultures, that really helps to reduce stigma and potential shame or distress around gender diverse identities. And then psychoeducation around different types of access around affirmation in gender identity. So that can be legal pieces, social affirmation, like name, changing expression, clothing, and then medical affirmation, like access to puberty blockers for youth, gender affirming hormone treatment, and potential surgeries. And again, not all gender diverse folks need or want medical intervention, but we will absolutely be there to support and collaborate with our medical system to help folks get access to that if they wish. So a little bit, oh, yep.
Someone asked a question.
Mhm.
Chat, they asked, well, first they said, this is amazing resources for our LGBTQ plus community. How can I get an application for the LGBTQ training?
Ooh, good question.
I put the link in the chat.
Link in the chat. Okay.
Links in the chat.
Yeah, I'll repost it.
Okay, thanks. So a little bit more information about what case management and resource linkage looks like. Our focus again is to support holistic health of the client by providing linkage to resources. And so we are really aware that it's not just direct service mental health support that folks need to encourage holistic health, but supporting all of themselves. And so yes, resource linkage, and then also helping county systems be more gender affirming and gender aware. We will be doing a lot of referrals to other programs, collaborating with such services, collaborating with other support groups outside of the Q Corner and our offerings. So we really hope to create really solid partnerships with all programs within the county and county contracted agencies as well. And then, of course, we will be writing letters of support. Letters of support are the letters that gender diverse folks need to access any type of medical intervention. And that's often written by either a behavioral health provider or a medical provider, depending on the intervention and depending on the provider's comfort with offering that type of service. But that will be a service that we offer as well. That's it. This is my email address. If you all have more questions for me, I think we have time for questions for collective in general for the Gender Affirming Care Clinic, as well as for the Q Corner. So feel free to ask questions right now, but offering this as a resource as well. Also, my last name is difficult, so I want you all to be able to see it. And then thank you.
We do have one more question. How can we request soft copies of the trifolds? For example, the SOGI data collection best practices.
Yeah, they can email the Q Corner or me, we can put it in the chat.
Isa is saying you can email the Q Corner, which is this email address right here, or Isa directly, and they will put that in the chat.
It's in.
Put the link tree in the chat.
And Issa's gonna put the link tree in the chat, or Alicia will. Yeah.
What? No?
Any other questions? Great. Okay, thanks.
Thank you so much. That was amazing information. Thank you all to the presenters today for doing a great job and giving us so much a wealth of knowledge. Just a reminder to everyone that this presentation will be posted on our website for future reference. And the next behavioral health informational session, which was scheduled on July 26th, will be canceled. Unfortunately, that was regarding the Navigator program. But mark your calendars. The following one on September 13th will be on school linked services. So thank you all and have a wonderful day.